The eye area is really delicate and is one of the most common concerns that people come to see me in clinic with. It could be the under eyes that bother them, but in a lot of cases, it's laxity of the upper eyelid that becomes a more significant concern and is something that almost everyone will notice about their faces as they start to age. So why does this happen to the eye area? Well, the eye area is really delicate. It has the thinnest skin on the whole face and so does tend to age more rapidly than other areas. Also, we're not that good at protecting it. We might not apply sunscreen to our eyelids, for example, because we think our sunscreen irritates us if we do that. And many people don't really wear the right sunglasses or wear them enough. So it's really important to think about how you can protect this area. And there are good sunscreens specifically developed for the eye area available. And if you do want one to apply to the eye that's a more generic one, look for a mineral one because it's often the chemical filters that if they run into the eye can be a bit more sensitizing. Good sunglasses with polarized lenses, and remembering that actually you might need to wear sunglasses as much through winter as through summer. I certainly find myself wearing my sunglasses year round, especially when I'm driving. So really considering those as ways that you can help to prevent the eye area from aging is crucial. But if you do start to get eyelid laxity, what can you do? A good eye cream at home certainly helps. Better quality skin, thicker skin is never going to be something that anyone complains about. So I'm a big fan of the Skin Better Science eye creams. The Interfuse Eye is really hydrating, but the Eye Max I find very good. It has a patented retinoid complex which really helps to stimulate the skin. Tweakments, there's quite a lot we can do here. As we age, the shape of the eye socket changes. So in youth, we have an eye socket that's a little bit smaller and sort of tilts upwards. As we age, through the bone loss that happens in the skull, the eye socket becomes a little bit larger and starts to turn downwards. And as that surrounding bone structure deteriorates, we get less tension holding the upper lid skin. So thinking about using strategic volumizing fillers through the temple area, through the cheeks, can really help to put tension back onto that eyelid skin and improve the appearance of a lax eyelid. Combining that with Soft Wave. Now, Soft Wave is a great skin tightening treatment. It uses ultrasound to stimulate collagen production in the skin at a very targeted depth of 1.5 millimeters, so it's very precise. And we can really pull that upper lid skin to treat it and give a nice eyebrow lift. And that can be anywhere between 2 and 5 millimeters with an average of 3 to 4 millimeters. It's a significant lift. Another thing that contributes towards eyelid laxity is that we become a little bit heavier on the brow as we age. And when we frown, we pull our brow downwards. And when we smile, we also pull the tail of our eyebrow downwards, which can help to lead to a heaviness around the eye. Using very targeted wrinkle relaxing injections around the frown and around the eye area, but avoiding treating the forehead, which can make us heavier, means that we can get a little bit of a lift to the eye area again of 1 to 2 millimeters. I always do talk to my patients who have more significant lid laxity about surgical options because an upper blepharoplasty in the hands of an experienced oculoplastic or plastic surgeon delivers really high impact with very surprisingly minimal downtime. For most people, the most significant downtime is about a week, with possibly another week or so on top of that where if someone looked closely they might see some stitches. But it's a very high impact treatment that can take years off you if heavy eyelid skin is what's making you look more tired and older than your years. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.